Okay, go.
Yeah, hi, this is Dr. Kondrot, and I'm going to be giving you some instructions on the ozone generator for rectal insufflation. So you'll receive your ozone generator in a box like this. And I want to just tell you, don't be intimidated. This is the generator here. It's very simple. O2 in, that's where the oxygen comes in, and ozone. And you have a plug for your electrical connection. We have everything here, and then you also get some tubing. So now we're set to go to the next stage. Now you need oxygen. It either has to be medical grade oxygen or industrial grade. The first thing you have to determine is if you can purchase medical grade or industrial grade. There are some patients who have difficulty getting a prescription for the medical grade, but the industrial grade is just as fine. Now the reason for that, there's two different types of valves. We have one for the industrial tank, and we have one for a medical tank. So you have to determine, the first step is to get the right tank for your equipment, and then let us know, and then we'll ship the right connector for you. Now this happens to be a medical grade tank. And this is the regulator. And it's very simple to connect. Even a retired eye surgeon can do this. And when you connect it, you probably want to make sure that your control valve is here so you can see it. Like that. Next, you'll get some tubing to connect the regulator to your ozone generator. And it's very easy to slide in. And then it's clearly marked O2. O2 in. So you're all set for this part. Next, you'll connect your electrical supply, and it plugs in the back. Right here. Plug it into an outlet. Now you do have some indicator lights here. You have the power, and you have the ozone. So when I do click this on, you hear some noise, and you hear the ozone light is on. That means it's generating ozone. Now you do have to be careful because ozone gas is toxic to breathe. It's wonderful for therapeutic treatments for rectal insufflation, or mixing it with blood, mixing it with water to drink, or making eye drops, but you do not want to breathe the ozone. So you do have to take precautions with this. Don't run it excessively. If you do smell something funny, make sure there's plenty of ventilation in the room. Okay, now that we're finished with that, now we're going to go into the nuts and bolts of the treatment. It also comes with an insufflation kit. And this is all the material you're going to get. You have 2 bags and 2 syringes. So let me open up one bag here. This is your rectal insufflation bag. You also have several catheters. These are the rectal catheters. And you also have a couple of syringes. The syringes are used for cleaning. You do not have to replace these catheters after every use. You can simply rinse them with water. If there is some fecal material inside, you can fill this syringe with water and irrigate the catheter. By connecting it here and irrigating it. Okay, now we're all set for our first rectal insufflation. It's a twist valve that connects right here to the machine. Very simple. and you also have a safety valve here. You want to make sure it's open, and to make sure if you can slide it, that means it's open. If it's locked, you're not going to be able to put any ozone into the bag. If you also notice, there's a little hand mark right here for different levels. So if your finger's right here and you fill this bag up, you're going to get 200 cc's. If your finger's here, you're going to get 400. If there's nothing, the whole bag fills up. So what I recommend is you begin with 200 cc's. 200 cc's by putting your finger here. Now you also see it's important that you use the right concentration. The ozone comes in different gamma. It's recommended that you use 37 to 40 gamma for rectal insufflation. And if you look over on the chart, the setting should be 1/8. Now what does 1/8 mean? Well, 1/8 means the setting on your valve. So your valve has different settings. 1/8 is the setting right there. So you want to make sure the valve is set right. Now it's interesting, the faster the oxygen flows, the less the oxygen is going to be ozonated. The slow flow, you get much more ozonation. That's why we're using 1/8. That's 1/8 liter per minute, which is slow, so we get the maximum ozonation. Okay, so we have our bag connected. Then you turn on your oxygen. When you turn on the oxygen, you should see the needle in the green area, which indicates full. This is an empty tank, so I have no oxygen in here. So imagine the needle's by green. Then you're set to go. What you do is you just hit the button here. The green light comes on, put your finger here, and you wait until this side becomes full of ozone. When it's done, you shut off the button. Then what you do is you lock it so the ozone doesn't escape. Then you disconnect this. It's very simple. And you have your ozone in the bag. Now, it's going to be really full with your finger here, but once I take my finger away, it's going to leak in the bag. So don't think that, oh my goodness, all the ozone disappeared. No, it's still in the bag. Then you're going to get your rectal catheter, connect this. Then you're going to use olive oil. You don't use Vaseline, you're going to use olive oil. And I recommend a good grade of Italian olive oil. Now, why olive oil? Ozone will interact with petrochemical products, and it will make harmful byproducts. So you don't want to use Vaseline. You want to use olive oil. Olive oil is very safe to use with ozone. Matter of fact, some companies actually make an ozonated olive oil for your skin. So then you just dip the end of this, then go into the bathroom or lay on the side. You insert this rectally. Once you're certain that's inserted rectally, and you don't only have to go maybe 1 or 2 inches. You don't have to worry about going in too far, because when the doctors do a colonoscopy, I mean, they go up a couple feet. So don't worry that you're going to hurt yourself. Go in a couple inches. Then when you're ready, open up the valve, and then you're going to roll this to get all the ozone gas.
Push it into your body.
Push it in. Hold it. Now, if you let go of this, the ozone's going to go right back into the bag.
Back out.
So you put it in, you bear down your sphincter, and you pull out the catheter. Then hold it for about 10 minutes. Now, the ozone is very quickly absorbed through the rectal mucosa. So even if you lose some within the first couple of minutes, you're still getting an effective treatment. As you do the ozone, you're going to become more and more comfortable. When I first started to do it, I would lose gas instantly. After a while, I've had more control. Then I would recommend after you do 200 for a while and you're comfortable, you may go up to 400. I also recommend that you do this 5 days a week, Monday through Friday, take a break on the weekend. And this is probably one of the most powerful treatments you can do. oxygen uptake. It's very powerful for regenerating tissue, and it's quickly absorbed into your bloodstream, going to your eye, your optic nerve, parts of the body that's needed. So many people will feel increase in health, vitality, more energy. So it's a wonderful therapy.